Good afternoon, ladies and gentlemen. Our webinar is going to begin. My name is Steve Love. I serve as President and CEO of the Dallas-Fort Worth Hospital Council, and we want to thank each of you for being here today for this educational webinar. It's hosted in coordination with VitalTech. VitalTech is an associate member of the DFW Hospital Council. VitalTech is a rapidly growing provider of digital health solutions and biomedical wearables. They provide real-time remote patient monitoring. Their platform enables health systems, nursing facilities, home health providers, physicians, senior living facilities to streamline their workflows while improving patient outcomes, patient safety, and cost. Today's topic, Virtual Hospital Today, is an important discussion, obviously, during the COVID-19 pandemic. We've got two expert speakers that are going to discuss how their innovative medical-grade biosensors integrate seamlessly into a suite of easy-to-use devices and software. We're delighted that our first speaker is Ernie Iannacci, Executive Vice President and a co-founder of VitalTech. For over 30 years, Mr. Iannacci has been involved in marketing and management experiences in different companies. His strengths include global strategic alliances and innovation in launching new products. He is going to be joined by Dr. Anjan Paneer-Selvam, the Chief Technology Officer at VitalTech. Dr. Selvam has made significant contributions in the field of biosensors and electrochemical sensors. He's developed over 8 patents and has over 40 publications. He has successfully produced multiple biosensor solutions that have greatly enhanced the current point-of-care testing systems. This is going to be an exciting presentation, extremely beneficial as we continue to deal with COVID-19. So without further ado, it's my privilege to introduce to you Mr. Ernie Iannacci. Ernie, I'm going to turn it over to you.
Thank you very much. So I believe that we do have the ability to ask questions during the presentation. Chris, I guess correct me if I'm wrong on that, but please feel free, everyone, to ask questions as we go, or you can hold them till the end and we'll have a Q&A session when everybody's done. But without further ado, I'll jump right into it. What I want to talk to you a little bit about today is a couple of things. One is a comprehensive virtual care platform, and then also some sensors and wearables that integrate with it that allow for, again, quite a bit of innovation in care delivery. So what we really are trying to accomplish is the move to virtual care. Trying to solve the big problems that everybody in our industry is struggling with, improving patient outcomes, improving care in the homes, reducing readmission rates. But the foremost problem that we're trying to address, and I think helping large health systems with, is the ability to deliver virtual care wherever the patient is. It's really all about meeting the patient where they are in any modality. Some of the highlights: home health, chronic care, telehealth, remote patient monitoring, post-surgical discharge. They're the big areas where this makes a big difference. But other areas like population health, ambulatory care, even in-hospital care, are moving towards the virtual world. And I hear over and over again from health systems that the last 6 or 7 weeks has compressed maybe the next 6 or 7 years. With COVID disrupting just about everything. And as you all know, as you've been fighting on the front lines, that's very true. Some of the things that we think about before I really launch into what everything looks like is engagement is about as critical as anything else when it comes to technology and delivering care. The average age on our platform before COVID was 87.6, and it was that way for a reason. We really thought about this in a little bit different way. We really thought about it as patient first. If you really can't solve the patient using the platform, and really the hardest to serve patients, 80 to 90-year-olds with multiple comorbidities that are absolutely non-technologically savvy, if you can't get them to use a virtual platform, then it's kind of worthless. If you can get them to use it and make them happy about it, everybody else is easy. The millennials and Gen Xers, they'll use technology second nature. But those, hard to serve seniors, they're the ones that are the challenge, and getting them to use it is paramount. And frankly, that was what we aimed at, and I think we hit. Also involving the family when possible, whether it's bringing them into the care discussion if they're needed to help with an aging parent understand what's going on in their care, or bringing them into dealing in pediatric care with their children, or even just in a shut-in senior dealing with isolation and some of the social determinants of health. But involving them and allowing them to be part of that really helps. Avoiding falls, as you all know, falls are a really large problem in senior care, and whether it's readmitting or them showing up in the ER or any of the complications from that fall, having a huge impact on the long-term health of that senior. But again, what's the most important is providing actionable data that's contextualized, that allows you to take proactive and holistic care of your patient across the entire continuum. Just wanted to give you kind of a high-level overview of what the entire system looks like and what I'm talking about. The middle there, that VitalCare IQ is the engine, and it's a cloud-based platform, and its job really is to bring in data from everything. And its job really, it brings in data, it contextualizes it, it makes it actionable, and it delivers it to the various stakeholders, meaning the patients, the care teams, the physicians, nurses, care navigators, home health agencies, and then the family members in the way they need to consume it, when they need to consume it. And then on the left-hand side there, you've got the data inputs. And when we talk about data inputs, we really mean data from just about anything. So whether it's Bluetooth medical devices, and that could be anything from a spirometer to a glucometer to an EKG reader, I don't know, thermometer, just about anything. If it has a signal, we can talk to it. To a wearable, we do make our own. I'll talk about that a little bit, a senior-centric health and safety wearable, but it's really important that the platform that you choose is completely hardware agnostic. You want to be able to use whatever the latest and greatest innovation in healthcare is next. So the platform you pick should definitely support open standards and the ability to integrate everything. So again, if it has a signal, we can talk to it, whether it's an Apple Watch, a Fitbit, a Samsung Gear, the latest, greatest sensor or patch that comes out there, we can talk to it. Sensors like ADLs or activities of daily living or other smart home devices, again, whether you're dealing with social determinants of health or just trying to baseline activity and what's going on in your patient's world when the home health worker is not there or in between visits, getting that baseline pattern and knowing when things change can mean the difference between intervening in a telehealth visit or maybe seeing the patient show up in the ER 2 days later because nothing happened and they became acute. And then things like third-party databases, whether it's a nutrition database, the CDC, the Mayo Clinic's new educational library, or even the Weather Service. Let me give you just a basic example that's kind of powerful in concept. The system is aware of what's going on with the Weather Service. So maybe tomorrow you have a COPD patient that's you're monitoring for chronic conditions, and our system knows that it's a high pollen, high ozone count day tomorrow. We can actually let your care team know, the patient, even the family know that if your patient goes outside tomorrow, there's a high likelihood of a COPD flare-up due to the weather, and that someone should intervene and stop that from happening. And if not, they're probably going to show up in the ER tomorrow. Again, simple in concept, very powerful in its avoidance of a bad outcome. On the right-hand side, as I talked about, you have your stakeholder views. That top view is what the patient would see. We strongly recommend a tablet showing up all kitted with the devices. With most of the large health systems we work with, they just put it all together. We get the order from the EHR, we put it together with the right equipment and ship it directly to the patient's home now in the world of COVID. We can actually send it directly to you guys and you discharge your patients with it. It's either model works, but in the current COVID environment, more than likely we're going to send it to your patient's home and they're going to take it out of the box, turn it on, and everything just works. And for your elderly patients that are not tech savvy, that is a model that gets much, much higher levels of compliance. Now, for a more younger tech savvy patient, let them download the app to their iPhone or their Android phone or tablet. And again, for better ROIs and lower costs, using their smart devices is certainly better and more cost effective. But again, having that flexibility across modalities is really what you should be looking for in a platform, so that you can serve your patients, again, wherever they are and in whatever form factor they need to be served. For the care teams, it's even more flexible. You should be able to log in through a browser, through an app, through a tablet, through a smartphone, through a computer, and we allow pretty much any way you want to access the system, you can. And most importantly, it needs to be bidirectionally tied into your EHR so that the physicians more than likely are not going to want to leave the EHR environment that they're used to working in, whether it's Epic or Cerner or Athena. They're going to stay in the environment they're used to working in. What we have found in most of our large deployments, that the care teams, the nurses and the patient navigators, they tend to migrate towards our system. It's quite a bit more flexible, user-friendly, and real-time data than the EHR. They tend to work in our system. And the physician tends to stay in the EHR and the data passes seamlessly between the two. But again, giving the care team the flexibility to move about between the two systems is paramount. And then for the family members, we have a Family Connect app that you can let them download to their smart device and invite them in, granting them access to see pretty much anything that either the patient or the care team needs them to see. It could be as simple as steps or calories, or as advanced as lab reports or CT scans or x-rays or anything really you need to share out of the medical record. On top of that, though, to help with things like loneliness and depression, it's a cross-platform video engine. So, grandchildren have now moved away. You have a shut-in senior that's got multiple comorbidities. They can't get out. Should be able to, with the push of a button on the same platform, be able to talk to their grandchildren. Maybe the grandchildren have iPhones, the senior has a older Android phone or an Android tablet now you provided as their health station. They shouldn't have to ever think about the technology. Again, push one button to talk to the doctor, another button to talk to the nurse, a third button to talk to the grandchildren, and they never thought about what technology made it happen. Again, you're just solving a lot of different problems with a single seamless platform. The platform itself has 4 primary modules. It has vitals, it has ADLs, or activities of daily living, it has nutrition, and it has medication. The nutrition module has 4 primary ways to get data. It can pull it directly out of the hospital systems menu and POS systems if they're in hospital, or you can speak into it, you can scan barcodes, or you can type, and it pulls it out of 2 national databases. If you have patients with special diets, whether they're CHF or diabetes or hypertensive, it works holistically with the medication management module and the vitals. So, if you have a patient that their blood pressure's up 30% today, maybe they told you they did take their medicine, but yesterday they had 3 cheeseburgers. It's not a medication problem, it's a sodium problem, and someone needs to counsel them on diet. Or maybe they skipped their meds because you found out in the medication module that they actually didn't take their blood pressure medicine yesterday. So again, the modules can work independently, but they're really designed to work holistically and give the care teams much more information to holistically and proactively help with patient care. The medication module, you pull that data directly out of your EHR, and again, you can push reminders and also ask for acknowledgments. Did you take your Lasix today, Mr. Smith? Or don't forget to take your antibiotics. And oh, by the way, no dairy with your amoxicillin, or whatever. So again, all of these modules can be used separately, but they're really designed to work holistically in conjunction with each other for a more proactive management of your patients.
Hey, Ernie, this is Chris Wilson.
Yes, sir.
We have a question. In the hospital, does the patient have to log in to their own account to get these features?
There's a way to have it so that there is a no login version or there is a specific login version. So we have flexibility to go either way.
Okay, thank you.
Welcome. So this is just one sample of what a patient screen could look like. A couple of highlights here. It's very brandable. We have health systems that instead of VitalCare up there, it could be branded them. You know, that could say Advocate Aurora or Holy Name or some of the health systems we already work with. The blue area there where it says hello Jane Smith and the weather, that's active content. So we're integrated with SurveyMonkey. We have health systems that deliver COVID screening surveys there, home health agencies that are delivering patient surveys there every morning. What's your pain level? Do you need to talk to your nurse? Did you take your Lasix this morning? You can push educational content there. It can be scheduled or dynamic. Pretty much anything you want. You also have the ability to do a full screen takeover. If you absolutely have to know that the patient performed an activity, you could take over the entire screen and get your answer, or they can't do anything else. Same thing with the tiles, all customizable. Just as easily launch your portal instead of the more or the profile button, or my charts if you're an Epic user, or anything you really need from here, so that the patient stays inside a single application and you're not having to launch multiple apps and confuse the patient. It's really to keep the patient in a seamless environment and direct them to be able to get a seamless health experience. The system is also a complete multi-party HIPAA compliant telehealth engine. So inside of the telehealth session, you can share live or historic vitals. You can share anything from the medical record, whether labs, charts, CT scans, x-rays. You can bring in remote specialists. You can bring in family members. You can do whiteboarding or screen sharing. Again, it's end-to-end HIPAA compliant. It's got integrated secure messaging built in, and you can record and archive any of it as well, all in a HIPAA compliant manner. You can also use other telehealth systems if you've already got one in place and just integrate with those. So again, it's all modular and it has bidirectional APIs for every section of the platform to hook into other hospital systems. So again, it's an all-in-one platform, but it's also extremely flexible to be able to integrate with everything else you're already using. So we don't force you to abandon what you're currently doing. We just give you the tools to augment what you already have, or if you're not using something, you get it from us. Quick snapshot of just what one of the care dashboards look like. The patients can be grouped in just about any shape or fashion you'd like, by disease state, by geography, by community. You can group alarms in just about any way you want. You can, maybe you want to have your COPD patients all routed to a certain triage nurse, and maybe a red alert is if SpO2 goes down to 92 and heart rate goes up above, a certain percentage. That's a red alert. It goes to this nurse, and maybe if only SpO2 drops but heart rate isn't accelerated, it's a yellow alert and it goes to this nurse, and so forth. But you have extreme flexibility in how you create your alarms and routing of patients if certain thresholds are breached. You can set those thresholds based on population, by disease state, and again by individual patient. And once you click inside of a patient record, we start a timer. That timer tracks everything. And when you're done inside that patient record, it asks for a CPT code. So whether it's an E&M code for a telehealth visit, a HCPCS code, an RPM or a CCM code, it then creates an audit log that's down to the second, create a complete digital audit record for CMS and the payers, and also a billing record that's easily exportable in any format to your billing engines. But it does all of the heavy lifting for you so that you don't have to worry about creating any of those workflows. And you get all of the history at your fingertips. So again, you're getting live vitals coming off of those Bluetooth devices or wearables, or any of the historic vitals if they're taking it more the old-fashioned way. We also, because of the new rule changes that CMS issued in January, that RPM can now be done under general supervision instead of direct. Now you can have care navigators or nurse navigators monitor patients remotely. We've created call center modules so that you don't have to. So we have remote call queues, alert queues, and to-do lists. Again, very sophisticated ability to route alarms and alerts. Again, you can set up your workflows just about any way you want. Extreme levels of flexibility inside the system, just a couple of mouse clicks and set up very complex custom workflows. We did all this so that you don't have to, but again, it can tie into any of your other systems via bidirectional APIs, so a lot of flexibility built in on how you can build out your workflows. That was kind of the software and platform portion of what I wanted to talk about. I'm going to pause just for a second to ask if there's any questions. I know that was a lot quickly before I talk about the hardwares and the biometrics. Okay, going to just dive forward then. So we also make biometric sensors and wearables. This happens to be one of our wearable watches. We built this initially to replace the pendant. A lot of our customers are in senior care, skilled nursing, long-term care, senior living. And the problem that we were addressing that we heard over and over again from our customers was my patient or my resident fell when the pendant was on the dresser. They just won't wear it. And we set out to solve that. And when we asked the residents and the seniors why they wouldn't, it was always a function of, I'm embarrassed, or it just shows that my life is over and I don't want to wear that thing. So when we asked them what they would wear, they over and over again picked the watch form factor. I know this looks a lot like an Apple Watch, but it's really designed to be very, very senior friendly. Big, bold print, very, very simplified screens. There's no wake word. All they have to do is say, I need help, and it calls. If they can't ask for help, say they fall, they hit their head, it'll call for them. It does vitals, it'll do heart rate, it'll do respiration. It has a built-in optical sensor for SpO2. It does do steps and calories for rehab. We actually have rehab hospitals using it for CJR. It is waterproof, so you can bathe and wash dishes and go about, all your normal daily activities with it. For memory care patients, it has a locking band and has an on-wrist charging mechanism that's magnetic, that only a caregiver can take the watch off if you do put it in a memory care location. And again, because it can't be removed in that modality, you need to be able to charge it on wrist, so we have that capability as well. It'll also tell you if it's off wrist and it's not doing its job. We have another version coming out shortly that adds a couple functions. Adds LTE, which means that it can geo-track if there's an elopement event. Say if you have a memory care patient that happens to get out and you need to track them. It also has two-way voice, and we've added EKG to it, which is a class 2 vital. So that will go through FDA. It'll be released under the wellness guidelines, but we'll turn the EKG on as soon as the class 2 certification happens. We also have ADL sensors. These sensors are very small, they're very unobtrusive, somewhat invisible to the senior or the resident, and you put them around the patient's home. They're really designed, when your care teams aren't available, whether you're using them in a hospital at home program or a skip the sniff program, where now you're no longer going to have 24/7 eyes and ears on the patient, but you need to still be taking care of them. Same thing for the watch. You're basically still worried about this patient, taking care of this patient, but don't have 24/7 coverage of the patient. So you need to know what's going on even when you're not there. Sensors, same way. They're building baseline patterns. Maybe you put one on the toilet, on the refrigerator, on the easy chair, the bed, the front door, and they build patterns. What does normal look like for Mr. Smith? And as soon as normal changes, the system's AI alerts. Maybe today it's 2 o'clock in the afternoon and Mr. Smith has gone to the bathroom 5 times and he's back in bed and he's never been to the refrigerator at all. Maybe it's a UTI, maybe he's developing the flu, maybe it's, nothing much, but regardless, do a quick check-in, a quick telehealth call. One, you can bill an E&M code, and two, you can more than likely head off something that's going to cause him to get something more serious and acute and show up in the ER. Either way, between home health visits, you've maybe headed off something that could be serious. And again, it's all about collecting more data and being proactive in your care, which is really what our platform is designed to do. Give you actionable data that's non-invasive to your patients to allow you for much more holistic, proactive care. Last slide on hardware. I'm almost finished. Because you guys don't really want to be in the equipment and logistics business, we are. So for all of our large health system customers, we do provide all of the medical devices, and we provide both forward and reverse logistics. So whether it's sending it directly to the patients, sending it to you guys for discharge with the patients, we can do it all. Your nurses will, check which devices are needed for each patient. We prepare them with the tablets. We get it all ready. We ship it directly to the patient's home. They just take it out of the bag and turn it on, and it works. And they, again, never think about the technology. We do have the ability also to pull the tablets back. They're the most expensive piece of the technology, and refurbish those for you, sanitize those, and redeploy them for you. And we're doing that for multiple health systems around the country. So if you do need that service, we certainly do provide it. If not, we can work with hardware that you guys are sourcing.
Hey, Ernie, this is Steve. We have a question, and I thought it'd be a good time to ask it. I hope it's not interrupting. I'll wait until you finish. But the question is, when you say bidirectional, do you mean these are getting feedback to the EMR as well? And how often does this data get updated?
I do mean bidirectional to the EHR, so absolutely yes. And honestly, the cadence is whatever the health system would like. We can update pretty much in any period that they'd like. So it's really just a matter of, do you want real-time data, which is, sometimes problematic for the EHR? Do you want it averaged? Where do you want it in the EHR? So we have the capability to push as often or as infrequently as you'd like it. And we've done it multiple ways with different health systems.
Thank you.
So quick case study, just wanted to sort of illustrate the flexibility of the system and how easy it is to actually implement. Holy Name Medical Center, they're right outside of New York City. We were actually going to just start a basic deployment for CHF and COPD monitoring with them right before COVID hit. We hadn't even signed the contract yet, and I got a call from them on a Friday morning as COVID was really starting to get hot in their area. They're in northern New Jersey, and they said, guys, we know we don't have a contract. Can you please make us go live this morning? We'll get a contract Monday. This was Friday. We're like, no problem. So we turned them on that morning, and they pushed out 1,000 of our apps to patients. They basically just emailed them and texted them links. They downloaded our software and self-registered. Immediately, they pushed out a COVID screening survey. Based upon the results, if they were symptomatic, they kicked off a telehealth session to triage nurses. If they were symptomatic but low risk, they just told them to self-quarantine and checked on them with telehealth visits every couple of days. If they were symptomatic but high risk and showed comorbidities, they sent them home health kits from us and put them on monitoring immediately. Obviously, if they were critical, they pulled them into the ICU. Simultaneously, though, this was a 385-bed hospital. They needed to basically make the entire hospital an ICU. They were in the process of being overwhelmed. So they needed to discharge all of their non-ICU patients so they could replace those beds with ICU beds. So they sent the bulk of their hospital home with home health kits and started remotely monitoring essentially their entire population and created an entire hospital worth of ICU. Since then, now they have put about 5,000 patients on our system, monitoring almost their entire population base remotely, and pushed the system out now to all of their remote clinics, all of their home health patients and all of their affiliated SNFs and LTACs. So again, we got them live literally in 2 or 3 hours, and they had the first 1,000 patients on the system within a day. Again, it was quite a fire drill. It took a lot of heavy lifting on everybody's part, but the system has a lot of flexibility, and they also wanted real-time monitoring for SpO2 turned on, which initially the system was designed to do more trend monitoring, but for Holy Name, we added a functionality overnight and turned real-time monitoring of SpO2 into a reality. And because it's a platform, the fact that we added that for Holy Name, we were able to push it out to every health system of all of our customers simultaneously the next day. And again, that is one of the power of having a platform, is features that one hospital asks for, everyone gets enhancements. And then just one study that has recently been published by one of our customers. They were looking at CHF and COPD patients. They were shooting for a 50% reduction in readmissions. Over the last 11 months, they've actually seen a 72% reduction in readmissions. These guys get about 5,000 patients a month that they're treating, and again, a substantial reduction in readmissions of their CHF and COPD. They've since expanded it to about 6 other disease states and have about 300 nurses now managing those patients. And then the last slide I have is really to illustrate where the vision and where we're going is the platform is truly designed to help you virtualize almost all aspects of your care delivery. The writing there, the darker writing in blue, are all the capabilities that are there today. And then the items in red are all the things that are on the roadmap that are planned. We have some significant large development partners, HCI being one of them. I'm sure some of you have probably worked with them. We're partnering with them on some of those items in red to bring some of those capabilities to market. But again, if you could just view this not just as a remote patient monitoring or as a telehealth or as a population health tool, it truly is a platform to help you build care delivery modalities and really to meet the patient where they are in any way necessary to deliver virtual care. That truly is what this platform is designed to do. And again, with its bidirectional APIs, hook into just about any other system you have, whether it's KPIs, analytics engines, any other system in the hospital to enable easier care delivery. And that's really it. I know that was a lot. I apologize if it was a bit data overload, but I did want to give you a very broad view of capabilities. And if you have any questions, I'd be happy to answer them, or turn it over to Anjan if you go deeper than I can answer.
Okay, Ernie, we don't have any questions at this time.
Okay. So Chris, do I turn this over to?
Okay, let me turn it over to him.
Okay.
There we go.
Okay, can you folks see my screen?
Yes. Yes, we can.
All right, perfect. Good afternoon, everybody. So what I'll do is I'll do a quick overview of the application as it is shown to a patient, and then I'll switch over to how it looks on a caregiver side as well. So to start with, I have this running currently on an iPad. The platform is customizable, so we can run this on an Android tablet as well as a smartphone. So we have flexibility there in terms of how the solution can be deployed and how it can reach patients of different demographics. To start with, there are two important contents or sections in the app. The one you can see on the left, obviously there's a dynamic window. Here there's a basic COVID screening question that can be pushed to them. Once I answer it, it immediately shows me information like something like weather. It can also populate air quality that's very specifically applicable to this user in case they have a COPD or any other breathing condition. So information very relevant and pertinent to the user profile is pushed here so that there is knowledge that the patient can glean from this. On the right side, you can see 6 different modules that are available or exposed. So in this case, these are again customizable. We have standard deployments as well, where we expose some features and make it available for the user. But the overall goal here is to keep the interface very simple and make it easy so that the patient is not overloaded with too much information, but at the same time is able to achieve what they need to do for health monitoring. To start with, I'll start with the vitals section. So here in the vitals section, we have different parameters that we can monitor through the platform. So definitely in this case, there are different vitals that we can study. So to start with, there's heart rate, respiration rate, blood pressure, oxygen saturation, and different parameters that could be directly collected from the patient. We have two methods in how we can input data from the patient. One is where, for example, if they have legacy devices that they would like to stick to, like a glucometer, we do provide the option where they can manually enter this value and add it to the patient record. But obviously, given technology and how we want the patients to make it easy and leverage the platform, we can let them install this device over Bluetooth as well. So for example, here, just for this demo, I'm going to delete this and start. So I click on add device. It gives me different options or different peripherals that can be connected. We have our own wearables, which is VitalBand, but in addition, we have other medical peripherals also that we can connect. We also pair with wearables such as Apple Watch. So if there is part of the Apple ecosystem that you want to bring in a wearable, we can connect and extract data from it. I have an oximeter here. So once I turn it on over Bluetooth, it immediately shows this to me. And I can click on just next to be able to connect and start collecting measurements. As you can see here in my profile, I have other devices connected as well that are available at any time for me to use towards data collection. You can see heart rate and SpO2 update in real time. And you're just, especially during presentations, my heart rate tends to go high, so you can see that climbing up. And all of this data is immediately synchronized and updated to the portal as well. So when we go to the physician portal, you can see how the data updates in real time for the physicians to look at. This data can also be shared over a telehealth visit. So if there is a video call or an audio call that a patient is having with a physician, they can share this information immediately with them. Next up, we have nutrition that's built into this as well. So this is another module that patients can use to log data. So here they would simply start by typing up, for example, a food item. And once they see this, they can click on this, and we do provide micronutrient information. And in addition, the ability for patients to adjust their nutritional values. So if there's 0.5 servings, what we do what we do better than other systems out is that it in real time updates the caloric value to show what the information is. So this gives a chance for the patient to be able to see this or use this as nutrition even analysis tool to be able to study what would be the food consumption and how they need to balance their diets. And we track all of the micronutrients here, so we do have that available for the patient to get some insight. And we have two more ways. We can also use voice to be able to dictate a food entry into this journal, or we can use the scan barcode mechanism to be able to scan as well. So multiple options available for the user. Next up, we have medication that's also built into the system. Here we have bidirectional capabilities to where we can pull medication information from our medical record, or we can have the physician manually enter these. In addition, we also have the capability for the patient to go in and edit. And once they're in here, you can see a lot of information available in terms of also shape, so that it's easy for senior citizens to be able to log a particular medication. Or we also have special instructions that can be pushed along. For example, if it needs to be taken with food, then they can definitely add that here as well. When it's time for a user to take a medication, they simply hit on take, and it immediately logs the quantity of pills as well as the time point at which this was recorded. So this helps in immediately logging and keeping this on track for medication reconciliation. Two important communication modules that we have in the application. We have video call that's built in. So as you can see here, there are family members to whom we can make a video call directly from this platform. We can also request an e-visit. So clicking on this enables us to be able to place ourselves into a call queue that physicians can then attend or have care navigators reach out to patients. We have bidirectional messaging also that is built into the platform. So in this case, for example, if there is a COVID-19 reminder or a screening questionnaire that's sent to the patient, we can use this as a tool to be able to communicate with them effectively. This is end-to-end encrypted and within the ecosystem of VitalCare, so it is HIPAA compliant and can be used to share medical information as well. Few other communication modules that we have surveys that are built into the system. So we have full-fledged surveys. It could be screening questionnaires or just a self-assessment survey that could be pushed to the patient every day. We give the capabilities to turn off any specific vital signs. So if there are conditions where they do not want to monitor few of these vital signs, we can turn this off and have those updated. And in addition, we also have documents. So if there are specific documents that needs to be pushed to the patient, could be wellness information or content, then those can be updated and sent to the patients as well. So that was a quick overview of how it looks on the patient side. Again, the goal here is to keep it simple and easy so that they have a targeted experience to monitor their vital signs and log everything related to their virtual care session. Next up, I'll switch over to the portal. Any questions so far, or I can start with the portal? So on the admin side,
do have.
Go ahead.
We do have a question.
We do have a couple of questions. What does a typical start with VitalTech deployment look like? That's question one. And question two, from the first patient onboarding to the full-scale operations.
Yep. Arnie, you want to take that? Or?
Yeah, so that's a complex question because we serve a bunch of different verticals in the healthcare space. So so let me give you an example. I'll use Advocate Aurora, a very large system, for example. So the first patient onboarding started in their post-acute group, and it really was, they just started with about 20 to 25 of their highest acuity patients, most chronic, the multiple comorbidities. We trained their nurses. This was pre-COVID, so they deployed them with their home health nurses delivering the kits to them and train the patients on site. It's evolved to more of a mass deployment now, where now we actually ship kits to the patients. They watch a video. If they have questions, they call in to either us or to the nurses themselves, and they onboard themselves. So it's become quite automated. Again, I already gave the example of Holy Name. Holy Name did it all automated. They onboarded 1,000 patients in the first couple of hours, all through email and text links, and let the patients self-register and download it themselves. So it's very flexible in its deployment methodology, and it's really customized by health system. So I hope that answered it, though.
Right. And while you were talking, we got two more quick ones, and you said we could interrupt you, so I hope that's okay. But
absolutely.
The question is, if the practice wanted to add on an assessment tool, such as a patient engagement scale, is that possible?
Absolutely. In fact, we have one inside the system, or we can integrate very simply with an outside tool.
The other question is, if English is not the primary language of the patient, can you set it for other languages?
Yes, it's already in Spanish and English, but we have the capability to translate it into 170 plus languages, really just prioritized by the health systems which ones they want next. And we're working on 5 more based upon some of the larger systems that we're working with.
Another question, do you have any tools built in regarding health education, preventative care in the community settings that people can look at that are outside of the hospital?
I didn't get into it, but we acquired a company called Breezy. They're for social determinants of health. And they have a very large library of curated educational content for both health and social, as well as we're tied into the Mayo Clinic's content library of educational content. On top of that, if you have your own content library, it is extremely easy for us to serve that up. So the way we built the system, it's extremely flexible for us to deliver just about any content, again, whether it's ours or yours.
Another good question, especially as you look at senior living, et cetera, can you monitor wound care and the care needed related to wounds?
Yes. In fact, there's even codes for that in the virtual check-in codes where you can scan pictures of the wound, and if that is attached and uploaded into the system, you can actually, there's a billable code for that in some of the new CMS codes for the nurse to just check on that wound care. But yes, and then we're also adding working with this company that's got a thermal imaging scanner for wounds that should be integrated over the next few months that can look inside the wound itself. So again, most modern advanced medical technologies, as they come online, the system's designed to be able to integrate those very quickly. You showing us something interesting, Anjan? Wasn't sure if you were trying to show us something, Anjan.
Oh, no, sorry.
Anyway,
yeah.
So the answer is yes.
Ernie, that's all the questions we have at this point, but I thought it was good to get them out there, and thanks for letting me ask those, and sorry to interrupt the presentation.
Yeah, no problem. Just kind of expand upon that wound care question, which is, I'm going to answer it with a little bit of a different, we've also been asking, for example, Atlantic Healthcare, a system in the Northeast, they found this inhaler that actually not only lets you know when the dose was taken, but the actual metered amount that was actually ingested. And it's a brand new inhaler that's being released to the market. It happens to be Bluetooth. It actually hasn't even hit the shelves yet, but it's coming out. And they've got the company to give us the Bluetooth stack. They're giving it to us next week, actually. And they're like, can you guys integrate this? And we're like, yeah, it'll like take 3 days. But that's really part of the power of the platform is advanced technologies that come out to help with treatment. The platform's built to be able to add those new devices and enhancements to treatment protocols very, very rapidly. And we don't charge for that. So once you've implemented our system, those kind of new innovative tools that are out there that aid in treatment, when health systems ask us to do things like that, it's just all part of what our service is. We never charge for anything like that.
Thank you. Appreciate it, Ernie.
Okay, Anjan, you're back on. You're running low on time, so you gotta go quick.
Yep. So this is a quick overview of the admin portal on the physician or the provider side. As you can see, we start with a dashboard that can be used to triage or handle incoming requests. So to start with, we have a call queue. So the call that we just requested from the patient record on the iPad, you can see the time that it has been in the queue as well as the condition that they've reported. And to be able to simply place a call, they would click on the video call button here or just hit resolve to be able to add notes to the record and resolve the action. Next, in this module, we also have alerts. So if there are specific vital threshold alerts that need to be answered or attended to or responded back, we can handle those here. And the process starts with where they would simply click on this particular patient record to enter the patient chart. And we can see all the different vital signs that have been updated or posted back to the user here. Few of the things, this provides information that's over time as well, so you can see a moving average that could be plotted or can help in analyzing either trending as well as information on how it has changed for the patient over a period of time. We also provide the capability to be able to monitor or adjust thresholds at a per patient level. So when you click here, you can see all the information that's available for each of the vital sign, and custom thresholds can be set for each particular parameter. We also allow the ability to be able to set this across a community, but it can also be enabled or micromanaged within a patient record. And you can see on the right-hand top side here, there is a timer. So as soon as I enter a patient record, if we do start logging in time, that can be used eventually towards either reporting a CPT code that's specific to a staff review or any other custom CPT code or ICD-10 code associated with the condition. So that could be immediately added or posted back, and it's logged within the patient record. Other modules that we were just going over on the patient side, we do immediately have, as I mentioned, immediate sync up. So it does bring in the value. We can see trends in terms of how different parameters have changed or updated. All of those are available for the physician to monitor. Medications, again, can be edited or changed from the physician side, or new medications can just be added by typing it into the search box and for the physician to be able to choose one and add it to the patient. We do have a comprehensive log capability, so we can track every parameter that is of interest to the patient record. So if there are any alerts that they're triggered, if, for example, different video call histories as well as call notes that were associated with each of the calls, all of those can be logged, analyzed, and exported back for compliance reasons. Within the platform, we also have a sophisticated tag system. So this can be used to filter and manage patient records. So it helps with workflow management. This also gives us the flexibility to adapt and work with the existing workflows that hospital practices or systems have. And I was mentioning different events can be scheduled for the patient. In this case, this survey that was pushed out to the patient, there is a pending report. Now, if I have to go back in time, I can also see past answered surveys. And once I click on this, the answers that the patient has reported are immediately available for the physician. This can be exported or can be used to trend or build analytics on top of how different patients have responded to different questions in a survey. As part of the kit, we also track all the different units. So if there are different devices that were connected or paired, we can pull that and track that so that it's easy for physicians as well as caregivers to manage what devices they're using. And we have an end-to-end messaging system as well, as mentioned before, that's built into the platform and is end-to-end encrypted. Other capabilities that we do offer here are the capability to have admin-to-admin messaging. So this can perform as an in-practice messaging tool and also as a video and audio call tool for different admins to have interprofessional consults. In reporting, we do provide a sophisticated report system for both audit as well as billing with all the CPT codes as well as time that's spent for remote patient monitoring.
Just a note on why that inter-practice messaging and calling is important inside the system. If you are going to bill the CPT codes for RPM, all that time counts towards the codes. So doing it inside the system, you accrue that time and it's tracked in the audit log and in the billing records. So again, it captures all that automatically and adds that to the patient record towards the billing codes. Again, you don't have to stay in the system, but if you do, again, it gets automatically added all to the codes and the billable time.
Yep. And then here we have in the logistics page the ability to be able to track if there's a shipment that was shipped and we need to track those, then we can study that here, and as well as manage patient conditions if they're active or if they're deceased, or we just need to pause monitoring on them, then we do provide the capability there. In admin tab, we do have different options. So this can be accessed on a tablet or a browser window on a laptop or a computer. So we do provide capabilities to customize those views. Our platform also has the ability to manage groups. So different disease conditions can be tagged into groups, and then we can have users also assigned or allocated into each group and be able to save those to accordingly send messages, questions, or different events that are associated with the group. Thresholds, as I was mentioning, can be set across a community, and each threshold can be sent to could be enabled to send an alert. So once it's active, we can trigger an alert, and this could be a text message, a phone call, or simply a push notification saying that a patient has breached a certain threshold. Especially in situations of COVID monitoring, we do have different employees using this towards employees as well to monitor real-time data, as well as for patients to monitor how they're trending. And we do in the platform have the ability to be able to create new questions or surveys. We can import this from existing systems as well using APIs. And what we do provide to the practice is also the capability to manage all the individual systems or individual doctors inside the practice. So we do have a sophisticated hierarchy system that lets them manage multiple levels of either physicians or different staff members to accordingly make their workflow happen. So that was a quick overview on the portal, and I'm happy to answer more questions.
We have a couple of more questions, and some of these, might be for Ernie as well. Let me see. What has been the overall response on the deployment of this? For example, are nurses and respiratory therapists still going into the room to check with the patient to ensure the data is correct?
In the first couple of days, you still get a lot of second guessing and checking, but we found in over the first weeks of the COVID crisis, nurses began to trust this pretty quickly. So less and less you had them needing to go in and check on it. Again, you're always going to get spot checks because people want to make sure. But we definitely found in some of the hospitals where this was deployed that it kept the staff safe. So
good question. Here's another question, and this probably is going to vary by situation, but how much generally does the tablet cost the patient?
So, there's a range of costs in the tablet. At the low end, it's about $155 to $160. And at the high end, it's about $255 or $260. It really just depends on the quality of the tablet and the length of deployment. If you're going to go to a chronic patient that you plan on keeping it for a while, you're going to go to probably the more expensive, say, Samsung tablet. If it's a shorter term deployment, you probably could get away with a little bit lower cost tablet. And we have a menu of options, or you can let the patient bring their own, which is another option that some systems do.
Right. While you're answering that, we got two more questions. Based on your current client base, in VitalTech's opinion, what's been the biggest financial impact to health systems? Is it cost savings or revenue generation?
To the bigger health systems, it's probably cost savings by readmissions, reductions, and staff augment. I would probably say to the larger health systems, it's probably cost savings. To physician groups, it's dramatic revenue enhancement because they're more fee for service still, and they're billing the codes, especially in a place where they've taken such big hits in this COVID world where patients aren't willing to come in. So they're using it both for telehealth, billing the E&M codes, and also for RPM, billing the RPM codes. And it's been a lifesaver for many practices that have had it in place, that their peers took monster hits in patient, revenue losses, and they haven't. But for the big health systems, it's really more about avoidance of cost in readmissions and rehospitalizations.
Right. The other question, and I know Chris is going to put some information out after the webinar, but it won't hurt to go ahead and say it now. If we're interested in VitalTech, what is the best way to get in contact with you?
You could reach out to me at Ernie@VitalTech.com or Anjan, same thing, Anjan@VitalTech.com is probably the easiest way. We're still pretty accessible, or maybe, I'd say that's probably the easiest way.
Yeah, and the other thing is, I think y'all sent Chris, and I may be wrong, that if people go to DFWHC at VitalTech.com, so DFWHC@VitalTech.com, they can reach you.
Yep,
exactly.
That's a distribution list, and we could use that too.
Mm-hmm. And then one thing which we really haven't highlighted here for you guys, we've actually provided a 90-day program where we're willing to let you guys trial at no charge the bulk of the system. And again, that 90 days is somewhat of a flexible number. Obviously, if COVID reflares up, we're not going to say, sorry, your 90 days is up, time to pay. It's really because of COVID that we put that program out there. So if you're interested at all, we're more than happy to let you guys use this at relatively free of charge for at least the next 90 days, if not longer, based on COVID.
Well, that's great. I hope the hospitals on the line, they hear that, and even non-hospitals, physician offices, a 90-day free trial. That's pretty good. That's all the questions we have pending. But if overall you've gotten great questions and great feedback.
Yeah, really good. We appreciate it, guys. That's really good questions.
Okay, well, that's all, Ernie. That's all that we have today. Do you have any closing thoughts?
No, we really appreciate it. And again, great questions. Everybody always love talking to an audience that is so plugged in. So the questions are always so good. So thank you again for your time.
Yeah, and on behalf of all the participants, we want to thank y'all. This has been a great session. We can tell by the people and the questions how engaged they were. So on behalf of everyone, thank you very much.
Thank you.
Thank you.